Hi guys, in today's video we'll be talking about fibroid. You know how we do it. I'm going to explain the meaning of fibroid, the type, the symptoms, management, prevention and risk factor. Let's get started. What are fibroids? Fibroids are abnormal growths in the uterus. They are made up of smooth muscles and connective tissue from the wall of the uterus. Because I really want everyone to understand this particular topic, I'm going to be explaining every word. So what is growth? Growth is an increase in size and number of cells. What are cells? Cells are the smallest living units in the body. Just see cells as the living part in an organ. Every organ contains cells. Without cells, organ cannot function properly. Normally, the body regulates how cells grow, how they divide, and also how they die when they are no longer needed or when they are damaged. But when certain changes occur in the body, probably due to genetics or some other things, and then the body can no longer regulate cell growth, it leads to abnormal growth of the cells. The abnormal growth then come together to form a mass, which we see as tumor. In the case of fibroid, the tumor are not cancerous, they are benign tumor. The major difference between benign tumor and cancerous tumor is that the cancer have ability to metastasize. That is, it can spread to other organs. But fibroids does not spread to other organs. It is confined within the uterus. Fibroids are common in African women during reproductive age. Reproductive age means you are still menstruating, you can still get pregnant. Reason being that the two major hormones which are responsible for the growth and the survival of fibroids are still much available and intact during reproductive age. The hormones are estrogen and progesterone. Estrogen regulates our menstrual cycle. It stimulates the growth of our reproductive organ, while progesterone prepare our body for pregnancy and maintain it when it finally occurs. So during reproductive age, these two hormones are available. It is very rare to develop fibroid during menopause because the level of the two hormones will reduce significantly. So even if there is an existing fibroid, it's going to shrink during menopause. Fibroids varies in size. It can be very small, as in tiny, that it will not cause any pain. And it can be so large that it will enlarge the uterus and the abdomen will be swollen. Pause. So now let's talk about the symptoms. Frequent urination. This can happen when the fibroid becomes too large that it presses against the bladder, or when it is located in a place where it can put pressure on the bladder. Another common symptoms is back pain. Pain during sex is also another symptoms. Pain during sex is another symptoms. If you constantly experience pain during sex, you should go for checkup. Constipation is another symptoms where the fibroid apply pressure on the bowel, making it difficult to pass out too. Another symptoms is heavy bleeding. If you bleed heavily during your period, go for checkup. Bloating is another symptoms. Feeling of unusual fullness even when you are hungry. Now let's talk about types of fibroids. One, intramural fibroids, submucosal fibroids, subserosal fibroids, and pedunculated fibroids. Just like the picture we are seeing here. These are the different type of fibroids. Now let's take them one after the other. Intramural fibroids, they are the most common, and it is found in the muscle wall of the uterus. They make the uterus bigger. And then submucosa. Sub means it occur underneath the inner lining of the uterus. It affects fertility and it causes heavy bleeding. Subserosa. It grows on the outer surface of the uterus. It presses on the nearby organs like bladder, just like what I explained earlier. This is the type that causes frequent urination. Pedunculated fibroids. They are attached to the uterus by a stalk. It can grow inside the uterus or outside. Now, let's talk about risk factors that can predispose you to fibroids. Family history. If there's history in your family that someone has fibroids, you might likely develop fibroids. Hormonal imbalance. We've talked about the hormone, estrogen and progesterone. And then genetics. Being an African woman, you can develop fibroids. Early menstruation is also a risk. Not having children is also a risk of developing fibroids. So now let's talk about reasons why fibroids can grow back even after being removed surgically. One of the major reasons is, we talk about two hormones, estrogen and progesterone. As long as those two hormones are still existing, fibroids can grow back. And also age. And also during the surgery, maybe some small fibroids are left behind. Maybe they were not removed. They can also grow to become very large. What are the complications of fibroids? Infertility and miscarriage, pressure on bladder, chronic pelvic pain, severe anemia from heavy bleeding. So moving on to medical diagnosis, how do we confirm that someone has fibroids? The doctor can decide to do physical examination where he inserts a glove hand inside the vagina and then feel the muscles, and if there's any abnormality, he jots them down. Also, ultrasound is the most common. It's going to give a good image and size and even the location of the fibroids if there's any. There is also MRI. It is called magnetic resonance imaging. It is very expensive, so people don't really do it like that. Hysteroscopy. In hysteroscopy, a very tiny camera is inserted into the vagina and then it goes to the cervix and then to the uterus. Then it sends a video to the screen that is connected to it. With this, every tissue, every muscles, everything concerning the uterus can be seen properly. Now, let's talk about treatment. We are almost there. So, treatment for fibroids depend on age, the symptoms, the size of the fibroids, and desire for pregnancy. Maybe the person still wants to get pregnant or they are not interested in getting pregnant anymore. All these are what will determine the type of treatment that their doctor will choose for them. Medications can also help, like hormonal drugs. They can help regulate the hormone. Another treatment is hysterectomy. Hysterectomy is a permanent cure. It is complete removal of the fibroids and the uterus. With this, the uterus cannot grow back. Even when it is caused by genetics, when you still have the hormones, it can never grow back. But the woman will not be able to conceive because the uterus is being removed. Uterine artery embolization is another treatment. In this treatment, the blood supply to the fibroid is blocked and the fibroid gradually shrink and dies off. Since the exact cause of fibroids is not known, but there are things we can do to prevent us from developing fibroids. One, regular exercise. Drink water. Drink enough water. Eat enough fruits. If you notice any change or you notice any of the symptoms I've said earlier, go to the nearest hospital. This will be all for today's video. Stay tuned for my next video. Bye.